Welcome to the Tudor Dixon Podcast. We are so blessed today to have a doctor with us, Dr. Josef Witt-Doerring. He is with us today, and you've probably seen him talking all over about the FDA and medicines that are prescribed to us. You've seen him on social media on a bunch of different podcasts. So he has expertise here. He's actually a former FDA medical officer too. So we're really excited about having you. Thank you so much for joining me today.
Tudor, I'm so glad to be here. Thank you for having me on.
Absolutely. So as I said, we've seen you in many different interviews. We hear you talking about these medicines that I think people are interested in hearing about because we have people that in our lives, either we are taking them or people that we love are taking them every day. And we've seen this, those of us who have been around it, we've seen the changes in their ability to connect, their ability to have an emotional reaction, their ability to have intimacy, and it's devastating, these devastating effects. So I ask you, as someone who was at the FDA, how did these drugs get approved?
So, these drugs are, and people are often shocked when they hear this, what the studies are like to get them approved. So the first thing I usually emphasize is that the studies are only about 12 weeks long, and we've never had a randomized controlled trial go longer than a year. And that should be a reason for a lot of people to pause because we put people on these drugs for a really long time. I mean,
decades sometimes.
Decades, yeah. 50% of antidepressant users have been on them for 5 years or more. And the other thing is that this is why I do what I do now, because I worked at the FDA. I got to kind of see behind the scenes, and I was just like, this is crazy. And so the other thing that I noticed that was really shocking is antidepressants are said to be effective by the drug regulators if they simply reduce symptoms on a depression scale. Now, that's therapeutic for some people, but what I want to contrast this against is, when you hear the term antidepressant, you might think, well, I'm going to do better in my relationships, or I'm going to be doing better in my work, or, it's going to lift me out of depression and it's going to improve my life in these tangible ways. That's not the outcome. The outcome is decreased symptoms on a scale. And obviously you can get that if you essentially just blunt emotional range. And so what I really think is important for people to know is that antidepressant is a marketing term. People can kind of imagine all sorts of things when they hear antidepressant. Essentially, these are drugs. These are mood-constricting drugs. Yes, that effect can be experienced as therapeutic for some people, but it can also hold you back and make things worse. I mean, if blunting your emotional range leads you to staying in a job that you don't like, staying in a relationship that you don't like, being blind to legitimate problems or maybe health issues in your life, that's actually working against you. And I think that message has been lost.
It's interesting that you bring this up because I was just with a girl yesterday and she said one of her friends had a traumatic experience. Her mother died in a traumatic way, and that was what she wanted. She said, I think at that point she wanted to feel nothing. And they put her on these medications, and she said it really did make it so that she was not able to feel, and that was what she wanted at the moment. It's 5 years later. She's struggling to get off of them. And she said to her friend, I can't explain it, but I look at something, I know it's sad. I want to have an emotion, and I cannot have any emotion at all.
Yeah. And I think that is a really common experience that a lot of people go through. And I just want to say just quickly, these drugs, they have their place. And we will, and I'm a psychiatrist. I see this all the time. People say, I took it, it was helpful. They'll even say it's life-saving. I mean, if your life is in chaos and there's a lot of things going on, if you take something that can numb you or restrict your emotional range, you will experience that as therapeutic. But the issue is, and this is what's happened with your friend, is over time, you will start to notice that it's blunting positives. And so, yes, you're going to feel less negatives, but you may not feel the same way when you hug a loved one. You may not feel the same way when something sad happens and you go, I want to cry. You may feel blunted to maybe things happening in your relationship. Maybe your wife is upset, and in the past, maybe you would have been like, okay, there's something going on. I can tell just by the change in her, in the way she's responding to me, that I need to go and talk to her because something is festering. If you wipe that out, you will you're going to miss things. And so
Well,
it doesn't.
I want to stop you there because you make a great point, but a wife can understand you're not doing what I need you to do. And that can be a conversation. It can be incredibly frustrating, and that person may actually still not see it. But there is the opportunity for the other adult in the relationship to say, something's happening to you. We need to do something about it. How is this impacting youth? Because when I was a kid, these drugs really were not out there at all. I mean, I think in the 80s is when we started to see Prozac, and I was in high school by the time people were I was out of high school by the time people were really being prescribed this kind of medication. So I don't remember these situations happening. But I look at kids today and they are completely ignored by their parents. And I don't think their parents know they're doing it.
Mm-hmm. I mean, the impact, if I think about the impact of these medications on youth, I mean, for me, it boils down to some of the messaging that comes along with these drugs. Now, let's talk about adolescence. This is a very challenging time. You're hormonal. You're navigating relationships for the first time. Maybe you're trying to find out your purpose and what you want to do in life. In the zeal of the medical profession and somewhat the pharmaceutical industry as well, to kind of promote the drugs and also promote the messaging that people have chemical imbalances and that they need these drugs, we are changing the narrative about how people see totally normal problems. Going through a breakup, devastated, that used to be normal. Now it's a chemical imbalance. Dealing with problems of social isolation and loneliness, you might fix that in the past. Okay, this is something I need to work on. No, you have a chemical imbalance, not certain about what you want to do in your life, chemical imbalance. And so some of the issue is it takes like these smoke alarms, these normal things that trouble people. And, when you take the drug, it recasts it as a brain problem, essentially. And people are robbed of the opportunity of actually addressing issues. And you could just imagine the problems that would have is if you just kind of suppress the feelings about problems happening in that person's life for 10 years or something when they're on it, eventually they're going to have to deal with that when they come off the drug later on. And so I personally worry that it's getting in the way of just general maturation and the ability to deal with normal bumps in life.
Well, and I worry that if you have a parent that is on these medications, I mean, sometimes my daughters come to me with something. I mean, just the other night, I had one of them had an issue at school and she was crying, and my reaction is very emotional, and I'm holding it together for her, but it is in my head the rest of the night, the rest of the week, and I'm checking in with her and I'm thinking about, I know that you are emotionally hurting right now, and I need to come around you and make sure that I'm supporting you through this. But if you are on these medications, it is hard to break through your emotions. So as a parent, can you identify when your child is in an emotional state if you are not feeling those emotions? And if children are in a situation where the parent is essentially not bonding to them, what does that do to that child as they grow up?
Sure, yeah. And this is something that I have seen firsthand. I have parents who tell me, hey, because this is what I do. I bring people off the medications and they'll say, I had no idea how blocked I was to the problems going on with my child. I would be, sitting there doing my work at home, and they would come home after school and they would say things to me, and I would just kind of shrug it off, completely missing that there's emotional problems going on. And then when they come off, they start to notice it a lot more, and they realize they've missed quite a lot of their child's emotional life. Now the issue is that the person on the drug rarely realizes that they have a problem because essentially you're in a drugged state. So when it comes to how do you detect if this is happening to you, it's so important to have someone else, whether it's a spouse or family member or a very trusted friend, know you're getting on the drug, because they are going to be the ones who will say, you know what, you've kind of changed and I know you're calmer, but I think it's actually harming you in some ways. And so people need to be warned that this can happen at the outset of use, but they also need a spotter, someone there who can just say, hey, you might not realize this is happening.
But the problem is they might not care because they are in that state. I mean, it's like a double-edged sword because you can go to that person and say, hello, this is not you. This is a totally different you. And I mean, I've had this experience with people where they go, I can't function without this. So this is the new me. Mm-hmm. And then where does that leave everyone around them?
Yeah. It's, I think, I mean, that's a really challenging situation. And if you want to...
That's why I say this is something that, why does the FDA allow this? Because the FDA passes this, says it's okay, not our problem. This is going to go to the families now. And you are telling me, I mean, think about what you're telling me. A doctor prescribes something. A non-doctor, just a loved one around you, has to watch you and be ready to say, okay, it's gone too far. You're no longer you. And yet you're fighting the medical system because the doctor is still telling that person, no, you need this drug.
Yeah. It's a complicated issue, and I think one of the problems is, like, when we study these drugs, as I mentioned before, it's on this depression scale, and it's for 12 weeks, which is insane. We need to be, I mean, we should have said, like, if we're going to give people drugs that change their mood and personality, because let's face it, that's what these drugs are doing, we need to measure outcomes. How many divorces are happening between the two groups? How many people are saying that they're satisfied in their job? Because, like, that's where this is going to turn up. You know, when these drugs get in the way of, you know, your relationship, and it can lead to breakups, we actually need to be measuring these things. And the FDA isn't doing that. And I think you make a good argument that, you know, how safe are these really if we're not measuring that and we're only studying them for 3 months?
Hey, stick around because we have more with Dr. Josef Witt-Doerring. But first, I want to talk to you about my partners at IFCJ. You guys remember so clearly, it was almost 2 years ago that terrorists went into Israel and murdered more than 1,200 innocent Israelis and took 250 hostages. There are still hostages today. And it seems like the cries of the dead and dying are being drowned out by this anti-Semitic hatred. You guys see it? We see it all over social media. I am shocked by how intense the anti-Semitic hatred is right now. And this brutal attack on the Jewish people, the most brutal attack since the Holocaust, it's been forgotten as we have a world that looks away. But there's a light right now that shines in this darkness. It's a moment of love and support. This is a movement for the people of Israel called Flags of Fellowship. And it's organized by the International Fellowship of Christians and Jews. On October 5th, it's just a few weeks away, there are going to be millions of people across America that will prayerfully plant an Israeli flag in honor and in solidarity with the victims of October 7th, 2023, and their grieving families. And you can be a part of this movement too. To get more information about how you can join the Flags of Fellowship movement, visit the fellowship online at ifcj.org. That's ifcj.org. Now stay tuned. We'll be back right after this. So there's a lot of question about not only that, I mean, you talk about something very critical, relationships and how this affects people in their home life, but you see a lot of violence today, a lot of violence, and people, every time we see violence, they say, was there some sort of psychiatric med involved? It's crazy to me because we're so in tune to the fact that it could be a psychiatric med that you don't ask anymore. Were they high on coke? Were they drunk? Were they high on weed? It's always what was prescribed to them. Let's get a toxicology report. We want to know what was prescribed to them. And I was reading earlier about the trans shooter in Nashville. This is a young woman who was put on medication for depression at 6 years old. Now, at 6 years old, you cannot tell me that they knew that this child was clinically depressed and that there couldn't have been some other way to get this child through this emotional time in their life. But from 6 on, she was on medication. Is there a connection between these mass shootings and this mass violence and psychiatric meds?
Yeah, so there is a connection, but I have to come in and say that this is a multifactorial problem. I think we would all, I don't think anyone is saying that every single mass shooting that occurs, psychiatric drugs are involved, although I get cast as saying that sometimes. there's issues of social contagion going on. There's issues of access to guns. There's issues of drugs being involved. And yes, there are issues of people being on psychiatric medications which lead to behavioral disinhibition. My position on this is that people need to start looking at all of these factors, and they don't. They like to sweep it away and just say, it's guns or it's mental illness. We are not looking at this in a responsible way in terms of public health. And so I'd like to talk about why I believe these medications can lead to mass acts of violence and suicide. So this is not something that is fringe. If you open the drug labels, you look at ADHD meds, in the warnings and precautions, which is one of the highest sections in the label for the most important risks, it says right there, it says hostility. That is a really common side effect with ADHD medications. If you look at drugs like Abilify, which are antipsychotics, in the label, it will say homicidal ideation. This has been put in there by the drug companies because they have noticed that this is a side effect, and this has happened sometimes. If you look at the antidepressants, it will say that they increase the risk of suicidal thoughts and behavior. It also lists aggression, irritability, and hostility in there. Okay, now that's not exactly saying in the label these drugs can lead to mass shootings, but already you're seeing that for some people who are sensitive to these medications, again, these are rare side effects, they're not going to have that normal, like blunting, emotional constricting effect. They're going to have a paradoxical, unusual reaction, which you cannot predict. It just has to do with something about their biology, where they will become more irritable, agitated, or aggressive. Again, not common. Now, have there been cases where this has led to mass acts of violence already? And there have been, and these have gone before judges and juries. The most well-known case is Donald Shell. This was over in Wyoming. He had previously taken Prozac. He had a bad reaction. He became worse. And then another doctor, not realizing that, put him on a very similar medication called Paxil. They're both SSRIs. It never should have happened. If you responded negatively to one in the past and had behavioral problems, you don't put someone on this again. But that happened to him. Within a week of getting on this medication, he developed a psychosis. He became homicidal and suicidal. He killed his wife, he killed his daughter, and he killed his granddaughter. He shot them all, and then he killed himself. Now, the surviving son-in-law took this case against SmithKline. This is before GSK, and the jury found SmithKline to be 80% responsible for the death for failure to warn. He was awarded millions. I think it was like $6 million, which was a lot in the early 90s. They appealed it, but they were not successful, and the verdict has stood. And this has happened in many other cases. The media doesn't like to talk about this, but in many cases when there has been behavioral adverse reactions and it's resulted in violence or homicide, they have gone to the courts. Juries and judges, objective people have heard the evidence, and then they have ruled that the drugs have been involved. But when you say things like this these days, people say this is a myth. You're scaring people away from psychiatric medications. You're out there trying to do harm. There's no way they can do this. It's not true. It's in the labels already. It's happening in the courts, and we need to look at this with individual cases and.
Because if we knew, then maybe as parents, we would even react differently. I read that the Parkland shooter had been on ADHD drugs for many, many years, but his behavior hadn't improved. And I think oftentimes teachers will even push. I've even seen teachers push to get kids on medication. So this kid was on ADHD drugs. He was very aggressive. The reports from his childhood in the classroom, very aggressive with parents, had thrown mom up against the wall, still on these drugs. Clearly, if you've been this aggressive in school and you are under the care of a psychiatrist, which I assume you are if you're getting these. However, I will say I've known general practitioners that have been able to give out these drugs, and the monitoring is different. But I would assume that as a doctor, if you've given someone this medication, you would continue to follow up and say, how has the behavior changed? And mom and dad are saying, my gosh, he's getting in trouble at school. He threw mom up against the wall. That didn't change the fact that they kept him on these meds, and then he went in and there were reports, from what I remember, there were reports that he had been saying, I have these homicidal thoughts. And he went in and shot up an entire school. Yes. So when you say, people don't want to be freaked out about this, I agree, but this is a fact. This is not like a myth. This is not a maybe. This is a fact. And parents are afraid every single day that they drop their kids off at the bus stop or at school, that there is going to be a Parkland kid that could go in and do the same thing that this kid did. And we deserve to know if these kids are on medications that are causing them to have the negative reaction that should mean we take them off.
Yeah, we do deserve to know that. And I think really a lot of the time the critics out there who have an agenda against having this go out, whether it's a drug company or it's the American Psychiatric Association, any group that has a vested interest in the public seeing the drugs in a favorable way, they almost wield this, you're going to scare them away from drugs, as it's like a compassionate thing to do for society. Really, it's a form of intimidation against the critics. They want to say, you, Mr. Critic, you are dangerous. How could you ever, spread such a, conspiracy theory? But the reality is that's not compassionate from a public health perspective, because the compassionate thing to do is to be honest about what's happening. I mean, you can even say it's rare, because it is rare, and just say, despite this, we need to start looking at these things. We need to start looking at, why is this being missed? Because that's another issue that you touched on. Another piece of information is 80% of these drugs are given out by family medicine physicians. Most people listening right now will know that they get probably 5 to 7 minutes of FaceTime with their family doctor, and that is how these people are being monitored. And when you are monitoring someone in 5 to 7 minutes and you're spending half of the time talking about some other health problem, are you really going to be able to conduct a history where you're saying, is this drug making them worse in some way? Tell me about their behavior. Let me call their mom. Let me talk to someone at the school. What is happening is, so none of that happens. They just simply assume that the mental illness is worsening, and they increase the dose or they add another drug because it is expedient and it is faster than really kind of digging into things. And so adverse behavioral side effects are frequently missed because they are hard to detect in short visits.
At what point do you say that doctors should be investigated if they have a history of having patients just kind of load up on drugs? And I'm serious about this. And I know people go, oh, well, you don't know what's best for the patient. But I know people that they put them on an antidepressant, they put them on an anti-anxiety, they put them on Adderall, all three of those. And then they end up having a facial tic and they have to go on some medication for that. And then they end up having high blood pressure and they have to go on a medication for that. And suddenly you are trying to patch. It's like there's holes in this bucket and you're trying to patch every possible place to prove that a medication is doing something good while it destroys every other part of this person's body.
Yeah. I mean, you're going to get a hot take from me. This is not what I think most people believe. But personally, I don't think family medicine doctors should be prescribing things like antidepressants. I mean, you're giving a drug that can potentially change someone's personality and their mood. It can affect their relationships and their work and their ability to recognize problems in their life. That should be done by a psychiatrist who has enough time. Now, we have this narrative in society now where it's like depression, anxiety, it's so common, these drugs are so safe. I think it's completely wrong, and I think that needs to be changed. I think we need to treat these drugs, which can be useful for some people, with the respect that they deserve and with the time that they deserve, because, listen, there's nothing more complicated than giving someone a drug that can alter their mood and personality.
So you shared a post recently. It's really graphic, but I want to talk about it because you shared this post about this person getting an MRI, and it was shocking to me, but not shocking to me because I'm a cancer survivor. So I've been through the MRIs and the CAT scans and the biopsies. And one of my biopsies for my cancer, they said, we're going to do this biopsy. And I thought, yeah, I've had other biopsies. That's fine. And they were like, it's going to be a mammogram biopsy. And I had no idea what this was. And you have to climb up on this machine and you're like half on top and half on bottom. They're sticking needles through your body parts and you can't move at all, like not at all. And they told me ahead of time, you can't move. Your legs are going to be up above you. Your arms will be out. If you even so much as have an itch, you have to tell us you cannot move. And afterward, I got down and the woman said, "Did you take the Valium?" And I said, "What are you talking about?" And she said, "Oh, that test is so stressful. Generally, we offer someone Valium ahead of time." And I said, "Oh, nobody mentioned that." She said, "You were just very calm." Because when you're in that situation, I mean, I know that there are people who panic, but I do think that they talk you through it enough that they know if you're ready or not. But you shared with a story about a patient who was going into an MRI and they offered them an anxiety med before they went in. The patient had a terrible reaction, gouged out their own eye and ate it. That is terrifying to me.
Yes, and so again, putting it in context. Listen, this is the first time I've ever heard of it. You need to hear that these medications, in rare instances, they can have very serious side effects, and so that's the point that I want people to hear. Benzodiazepines, which are commonly used to help people, go in the narrow tube of an MRI, they relax people. But they can cause paradoxical reactions like all drugs. And the point when I put that out there, because it was graphic and it was shocking, was that we've gotten so used to just, oh, you have a little bit of anxiety, just take it. You're a little nervous about being in the narrow tube, take this medication. What has happened to us? I think we can tell people, like, yes, some situational anxiety is normal, some claustrophobia is normal. And you know what? This drug has side effects. Maybe we go ahead and we try it without. I'll be there with you. I'm going to reassure you. You're going to get through this. It's okay. Very quickly, we just default to using meds, which, in rare instances can have absolutely horrific outcomes.
That is probably one of the most horrific things I've ever heard. And I honestly, I would have read it and said, no way, except for having my own experience in the hospital of them saying, we generally offer this to everybody. And I think we've had this inherent trust in the medical system. And, honestly, back then, that was 10 years ago, I probably would have been like, okay, they're telling me most people take this, I should take it, without thinking, I'm fine, I don't need this. And that's the thing that I think is the unusual part about psychiatric meds. It's kind of like someone saying, you need this. Even if you haven't discussed, I'm not anxious about this test. There's a push to take it regardless. Like, we have a solution for you. And yet when you look at it with common sense, you would say, you know what? Am I going to take a pill every day and it is going to magically change everything in my life?
Preach is what I'm going to say, because I think there's something common sense about that, where it's like, how could that ever make sense, that you could take a pill and it, with the complexity of the mind and the human experience, that you could expect that to solve your relationship problems, your spiritual issues, your problems in your work? It's simply not true. It is just, it's too good to be true. And because it's not. That's not what they do.
Thank you so much for being here with us today, Dr. Josef Witt-Doerring. And we're going to have you back in the next podcast. We're going to dig into some pretty crazy subjects. We're going to talk about cannabis. And I know a lot of people think cannabis is safe. We're going to get into some of the things you might actually not know about cannabis. We're also going to talk a little bit deeper about those side effects from these drugs that have sexual dysfunction. But also, we're going to get into the trans issue. So it's going to be very interesting to hear what the good doctor has to say. But thank you all for joining us today on the Tudor Dixon Podcast. As always, you can go to TudorDixonPodcast.com and subscribe, or go to the iHeartRadio app, Apple Podcasts, or wherever you get your podcasts. And you can always check out the whole video. It is on Rumble and YouTube at Tudor Dixon. But make sure you join us next time on the Tudor Dixon Podcast, and have a blessed day.